Hi, I'm State Senator Mark Huizenga, representing Michigan's 30th Senate District. Today, I'm outside Exalta Health. Since 1996, they've been dedicated to making healthcare and wellness accessible to all. Based right here in Grand Rapids, Exalta Health has worked with underinsured, uninsured, and refugees to help create a healthier community. Their four main focuses are on medical, dental, spiritual, and behavioral health. This year, I was very pleased to head the effort for Exalta to receive a $1 million grant funding that will help them to continue their efforts to provide health, wellness, and services to those in need. Join me as I tour to learn more about this great organization. Come on in, let's learn more. All right, so we're here today with Dr. Vandermolen. Can you tell us a little bit about what kind of patients you see here and what kind of maybe conditions you're treating and just a little bit about the clinic?
Yeah, sure. Our main diagnoses are diabetes, hypertension, and then anxiety and depression and hyperlipidemia, so high cholesterol.
What about hours of service? How does that work for your population?
Most of our patients are working, many of them multiple part-time jobs, so daytime hours is very difficult. Our Monday evenings, we're open the second and fourth Monday right now in the evenings, and they're wanted spots. There's a lot of patients who are trying to get those spots.
How about children? Do you treat children here too?
So we have a growing peds population. We're really trying to be a place that families could get seen, and we're also trying to do some unique visits where you can have, if you have 2 or 3 kids, all of them have their well child exam at the same time.
The group visit instead of all these different visits.
Right.
Any mother would appreciate that, right?
Exactly.
Yeah.
So yes.
Yeah, so it sounds like common sense solutions, one-stop shopping with great outcomes.
Right, and then to add to that, we have behavioral health.
Oh.
So with that high anxiety and depression as part of our most common reasons to be seen here, we have a behavioral health social worker, and then we also have right now a psychiatrist who's volunteering, which is unheard of in many places, so that's super helpful for us.
Thank you, Dr. Vandermolen, and appreciate all the good work you do for us.
Well, and thank you for supporting us.
Yeah, you bet. Thanks so much.
Yeah.
This is Dr. Armstrong. You're the medical director here at Exalta, and you guys provide the dental services here. This clinic has all the gear you'd expect from any other dental clinic that you might go to, no matter what your economic or social position is in society. You guys really have great equipment here. What kind of things do you see? A lot of cavities, or you end up doing extractions, or what kind of cases do you see here?
Some people fortunately have very good teeth, and so they maybe haven't seen a dentist in a while, and they literally need nothing, just some reassurance. But then there are also people that need hours of work, and we will schedule an hour to get the ball rolling, whether they need many teeth removed or they are missing their front teeth. And so we see a little bit of everything, and it's always nice when someone comes in and they're more anxious about their concern. But there's plenty to do.
Sure. I know a lot of times if a refugee group comes over, they're coming as a family unit, and being able to say that you can treat the mother, the father, the child here both medically and dentally, that's a big deal. Can you talk a little bit about that experience and maybe how you maybe cared for a group or a family like that?
They've been established now. I think the parents may even be citizens now, but I just remember meeting the mom and dad. They had 3 daughters, and just got to know them over the years, and that's really been a nice relationship to maintain.
Anytime you have a relationship with a family, it probably really demonstrates that you're providing great care across that continuum. Well, thank you, Dr. Armstrong, for all you do for our community, for providing great dental care, and for being a real resource for our community. Really appreciate it.
You're welcome. Pleasure.
Well, hi, Alma. How are you doing? Mark Huizenga. It's great to see you. And tell me a little bit about the work that you do here. I know that you're probably one of the more important persons from the dental side of things here, but even more importantly, you're part of this neighborhood.
I feel a little more involved in the community. I know what the need is, a lot of struggles, and so I just want to make sure when I'm working here, I understand the patients. Sometimes there's a high demand currently for dental, so I try to understand them a little more, try to get them through what I can.
If people from your neighborhood just knowing that maybe they know you, like to say that the people here speak Spanish, it puts them at ease.
Our population here is the highest is the Hispanics, so, and the neighborhood here is mainly made up of Hispanics or Latinos. And so them coming here, wanting them to feel comfortable as well, knowing that someone speaks Spanish, they can get their point across, their concerns. So not only am I just clinically, back there with them, assisting with translation, but I'm also back here on the phone, understanding them and what they need to get done, or what their need is.
Sure. Well, thank you so much. Appreciate
Thank
your
you.
time today.
Of course,
And thanks for
thank
the great work you guys do here at Exalta.
Thank you so much.
Hi Ed, how you doing? Great to see you, and it's so great to be here at Exalta Health. We met quite a few years ago, and you told me the story about Exalta Health, and it really struck a chord with me about what you do, caring for refugees, caring for those without insurance, those with minimal insurance. Doesn't matter. You take care of them. If there's a need, you guys are there.
It's we're a faith-based nonprofit, and we really lean heavily on the word nonprofit. The fact is that we rely on the donations of good people. We work with foundations and the like to support us.
And I think it's important to note that when the community comes together to take care of the community, it makes our community better. Your story is so compelling that I was really proud to work hard to get you guys revenue from the state, to get a grant for $1 million. Can you tell me a little bit about what that means to a clinic like?
When you told me it was coming, I was shocked. I mean, truly shocked, and so grateful. We have a baseline care here. Our clinic everyday operation is pretty much our baseline. That $1 million is going to help us to be able to reach out into the community and to bring health care to people who might not otherwise access a clinic like ours.
One of the things that people don't think about is that if we take care of people at the primary care level, it actually ends up saving the state a lot of money.
It does.
Because you take one case where they've got really bad tooth decay and it winds up turning into some sort of osteomyelitis or some terrible disease. They've got to go through the emergency department. They don't have insurance. They're hospitalized for many days. They may become Medicaid. All those things cost the state a lot of money, but putting the dollars right here in our community, making things better for them, it saves the state money, it gives a better community, makes people feel wanted and being part of a productive part of probably one of the greatest parts of our state, Grand Rapids, where we see growth, great community, and open arms for everybody.
You bet. And we're so grateful for the opportunity to get even deeper in with refugees and with the Hispanic neighborhoods, the Black neighborhoods, and the state just helped us do that even better.
Yeah. Well, thanks, Ed, and congratulations. I'm so proud to help and stand up for Exalta Health. Appreciate
Great to see you. Thank you so much.
You bet.